So, you are 27 weeks pregnant, and in this video, I'm going to talk about baby development, what to expect at your next OB appointment, and common problems that you might be experiencing like leg cramps and so much more. But first, if you're new here, you're watching the Health and Medical Zone. And if you're new here, the Health and Medical Zone means being in good health and good spirit. So, if you like being healthy and happy, click subscribe, because you're in the right place. Week 27 marks the very last week of your second trimester, and you are almost 2/3 of the way through your pregnancy. You are 6 months and 3 weeks pregnant, and you only have 13 weeks left to go. This is the point where we stop measuring crown to rump length, that's from the head to the bottom, and we start measuring your baby from head to foot. At 27 weeks, your baby is about 14 inches long. Your baby now weighs over 2 pounds, which is double what they weighed just 4 weeks ago. They're practicing kicking and punching like a little Olympic boxer, and all of those kicks and movements can make them feel bigger than they actually are. If you ever feel quick, short movements that are very rhythmic, your baby is probably having hiccups. Babies can hiccup over and over again in your belly, and this is perfectly normal. You'll likely start noticing hiccups quite a bit now. If your baby were to be born today, their lungs would be able to function with some medical intervention. And the further along you get in your pregnancy, the higher the chances that your baby would survive if they were born early. At 27 weeks, your baby would have about a 90% chance of survival, and only about 10% of those survivors have disabilities related to preterm birth. Your baby is continuing to grow more and fatter, filling out, and starting to look more and more like a newborn. Your baby's heartbeat is now loud enough that if someone were to put their ear on your belly in just the right spot, they might actually be able to hear it without any special equipment. Your baby's eyelashes are fully grown, and their eyelids are no longer sealed shut. They can now suck their thumb, which helps strengthen their jaw and tongue muscles. Their tongue has developed taste buds, and they can taste the flavors of the amniotic fluid, which changes depending on what you eat. So, if you had some delicious, spicy Mexican food, your baby may be tasting that about 2 hours later. Interestingly, babies have more taste buds than they actually need at this stage. They'll lose some of them by the time they're born, and we don't really know why. Babies can also make facial expressions now, which you may be able to see on a 3D ultrasound. They're beginning to distinguish voices and can tell the difference between different sounds and voices they hear. So, you can talk to your baby, sing to them, and have spouses, grandparents, and siblings talk to the baby as well. They're starting to recognize and distinguish between different voices now. Back when your baby was around 12 weeks, the red blood cells were being made primarily by the liver. Now, those red blood cells are being made by the bone marrow. At your next doctor's appointment, if you haven't had it yet, you'll likely have a blood sugar test called a glucose tolerance test to screen for gestational diabetes. If you do have gestational diabetes, your OB will either give you a special diet to help keep your blood sugars under control, or they may prescribe insulin to help manage your levels. Having gestational diabetes can increase your chances of having a larger baby at birth, and that baby may also have a higher risk of low blood sugar after delivery. It's also important to remember that having gestational diabetes does not mean you're going to have diabetes after your baby is born. Your blood sugars usually return to normal, but it does increase your risk of developing type 2 diabetes later in life, so it's just something to keep in mind. Now let's talk for a minute about childbirth classes. If you're considering taking a childbirth class, now is the time to start thinking about signing up. You'll want to finish the class about 4 weeks before your due date. These classes are especially helpful if this is your first pregnancy, but anyone can learn a lot from them. They cover laboring techniques, birth plans, the physiology of labor and delivery, and so much more. You can check with your local hospitals for in-person options, or you can choose online childbirth classes, where you and your partner can sit and watch together in the comfort of your own home. Now, let's talk about leg cramps. Leg cramps usually happen at night and most often occur in your calves or feet. When a cramp hits, you'll want to stretch out your calf muscles. You can do this by flexing your foot towards your shin and pulling your toes back toward you. The tricky part is that bending your knee so you can reach your foot can sometimes make the cramp worse. Because of that, I recommend keeping an elastic band or strap by your bed that you can loop around your foot to help pull it back toward you. If your partner or spouse is nearby, ask them to help by gently flexing your foot and toes back for you. You can also try to prevent leg cramps by stretching before bed and making sure you're drinking plenty of water. If you're planning on breastfeeding, you should know that depending on where you live, your insurance may cover a breast pump at no cost to you. Even if you plan on staying home full-time with your baby, I still recommend having a breast pump on hand. There are quite a few situations where a pump can be really helpful. For example, if you need to pump between feedings to help increase your supply, if you're planning to go out of town for a few days and want to leave a supply of milk behind, if you need to temporarily take a medication that isn't safe for breastfeeding and have to pump and dump to maintain your supply, if you want to continue feeding your baby breast milk after you stop direct breastfeeding, or even if you just want a night out and a little break for yourself, which you absolutely deserve from time to time. So, get a pump. Now I want to know how your tummy is feeling right now. As you get bigger, your skin stretches, and that stretching can make your belly feel really itchy. That itchiness usually starts around the 5th or 6th month of pregnancy. Make sure you're using a moisturizer every day. An itchy belly by itself is totally normal, but an itchy rash is not. You could have a pregnancy rash called PUPPP, which is common and easily treatable, so be sure to talk to your OB if you notice an itchy rash. Another type of itching that isn't normal is generalized itching, not just on your belly, but all over your body, including the palms of your hands and the soles of your feet. This kind of itching can be a symptom of a liver condition called cholestasis of pregnancy, where bile acids build up in your body and make you feel extremely itchy. Your OB can check for this with a simple blood test, so make sure to let them know if you're experiencing itching all over. If you're struggling with leg swelling, be sure to check out my week 24 pregnancy video. And if you're having a lot of back pain or round ligament pain, check out my week 18 video. I talk about that in more detail there. And if this is your first time on my channel, make sure to subscribe and share this video with a friend or sister who's pregnant. I've done a full week-by-week pregnancy series, so go check out some of my other second trimester videos. There's a ton of great information. You may also notice that when you lie down to go to sleep, that's when your baby becomes more active and starts kicking. That's likely because during the day, when you're up and moving around, you're gently rocking your baby to sleep. Once you finally rest, they decide it's time to wake up and move around. Thank you so much for watching.